Chlorpromazine, brand name Thorazine, is a typical antipsychotic that is commonly used to treat mental health conditions, such as schizophrenia and severe mood disorders. This medication is a type of antipsychotic, which works by affecting the levels of certain chemicals in the brain, such as dopamine and norepinephrine. This helps to regulate the brain activity and decrease the symptoms of mental illness. The starting dose of chlorpromazine is typically between 25 and 50 mg per day, taken in divided doses. The maximum dose can vary depending on the individual, but it is generally around 1,000 mg per day. The use of this medication should be closely monitored by a healthcare provider, as it may cause side effects such as drowsiness, dry mouth, blurred vision, and changes in blood pressure. Some of the laboratory tests that may be needed before starting the antipsychotic include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. There are certain contraindications for using chlorpromazine, such as a history of liver or kidney disease, a history of low white blood cell counts, and a history of bone marrow problems. Additionally, this medication may interact with other medications, so it is important to inform your healthcare provider of any other medications you are taking. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with chlorpromazine.